My name is Leigh Gleeson and I'm a first year Bachelor of Nursing Science student. For NS 1771, Becoming a Nurse, my chosen discussion point is the Nurses and Midwives Board of Australia 2012 Code of Ethics Value Statement 8. Nurses value a socially, economically and ecologically sustainable environment for health and well-being. This resonates with why I want to become a nurse, because I think people are precious, so especially the socially sustainable section. I enjoy making people feel safe when they are scared and empowering them to self-validate. I think I'm good at this and I'm able to transcend the lifespan and cultural differences and see past exteriors and genuinely love the disagreeable whilst maintaining healthy professional boundaries. This value statement is backed up by the Ottawa Charter, signalling a new vision for healthcare and wellbeing. People expect more from healthcare, as the Deeble Institute discovered in 2014. Consumers want to be more informed, manage their health and receive individualised care. So streamlined use of all resources to ensure their ongoing supply frees nurses up to provide that patient-centred care in a relaxed and confident manner. Reducing the carbon footprint of a healthcare setting is a 21st century challenge that the Kutek Puat Hospital in Singapore has readily accepted. They use water recycling, solar panels for energy, and they even grow food on site that the patients eat. Their wards face out to the environment and there's plenty of sunlight and fresh air. And the website is very health education focused, very appealing and engages the community. Florence Nightingale would approve, as in Notes on Nursing, she also valued proper use of fresh air, light, warmth, cleanliness, quiet and proper diet. I thoroughly look forward to being a part of a similar healthcare facility in Australia during my career. The service plan from Townsville Hospital and Health Service will refine its hub and spoke model over the next 10 years to provide birthing services, medical imaging and dialysis services to patients in outlying areas in hospitals and healthcare settings closer to where they live, saving remote Australians valuable travel time and keeping them near their family for support. This will also not overload other settings in more built-up areas. Closing the Gap is an ambitious project to address social sustainability in Indigenous populations, and I'm delighted to discover that the under 5s mortality rate has been halved, and also with the position of James Cook University in the top end, I might have the opportunity to work with Indigenous healthcare workers and support better Indigenous health outcomes. This all seems very overwhelming in first year, so much to remember and retrieve when I'm under the pump, but I trust my training and I know my ability. Everyday decisions about clinical practice affect the viability of it all. The bottom line for hospital administrators, the safety and comfort of patients and their families, and also whether or not a workplace is physically and emotionally safe for the nurses who are there. And then there are the trees to save. I heard a riddle once: how do you eat an elephant? And the answer is one bite at a time. So what I can do on a regular basis is wash my hands to Hand Hygiene Australia's standards to help reduce the 2017 reported 1,500 cases of HAIs in Australia. Communicate and collaborate professionally with colleagues, maintain my cultural competence and build rapport as I learn from more experienced healthcare workers. Learn and practice the clinical reasoning cycle to the very best of my ability. Embrace continuing professional development and graciously reflect on and improve my practice. Sensitively and kindly explain the science behind vaccinations, breathing practices, or a plant-based diet to a patient without being patronising. We're not alone as nurses, and there are professional bodies to help and assist us. The Queensland Nurses and Midwives Association secured better wages and conditions for its members. The NMBA is committed to ensuring nurses and midwives are made aware of relevant issues that inform professional practice, and it provides standards for registration, conduct and practice, which keeps nurses safe and creates an even playing field. The International Council of Nurses in Switzerland promotes policy development and champions the role of nurses developing new models of community-based care to promote health, well-being and prevent disease. Becoming a nurse later in life is rewarding. I'm kinder to myself, wiser and more patient and relaxed. I'm delighted that in 2018, healthcare is actually about health, and believe that as a planet we stay healthy when we are kind to each other. As the World Health Organization points out, we are our own main health resource.
Went to about